Good evening and welcome to Vax Facts and FAQs. Vax Facts and FAQs is a virtual discussion on how to stay healthy and get up-to-date information on flu and COVID-19. This month we'll be discussing COVID-19 updates, the updated vaccine, and staying protected, how we can stay protected this fall. And then we'll go over a few questions on the updated vaccine. So first with our COVID-19 updates, unfortunately there is an uptick still in hospital admissions and deaths from COVID-19 throughout the country. And so that is attributed to the new COVID-19 variants that are circulating. And we can talk about a little later how these updated vaccines perform with these strains that are currently circulating. But generally speaking, in Southeast Michigan, we are experiencing low hospital admissions. And with each community level or with each county's individual level of hospital admissions, there's different recommendations. So if you're in a county with high hospital admissions, we can infer that there's a high community level spread of COVID-19. And so with that, on top of our daily activities that we use to protect ourselves from COVID-19, we would want to consider wearing a respirator or a high quality mask to offer additional protections. Furthermore, if you are immunocompromised or for some other reason at high risk for COVID-19 or serious side effects from COVID-19 infection, you may want to reduce non-essential indoor activities as well. So based on your levels in your community, how you respond may differ. And we've shown those here on the slides. So next we'll jump right into the updated COVID-19 vaccine for this fall and winter of 2023. And we'll let you know what you need to know. So first, why do we need a new vaccine? And the reason is because we are working, these new vaccines work to target the variants that are currently circulating, where older versions of the vaccine were targeting variants that aren't in circulation anymore, or the most prominent variant circulating. And this is because all viruses mutate, and COVID-19 is no different, and COVID-19 is pretty good at it. So at this time, there are variants that are circulating that weren't circulating when these vaccines were formulated, but the studies are still showing that our immune systems will generate a response to these vaccines and protect us from these currently circulating variants because they are close enough to the variants that this was formulated for. Also, we need to know that this is not a booster. This is an updated vaccine. And to provide an example, it's more so how we have always approached flu. So with flu season, each year you get a new vaccine so that you can receive a vaccine that specifically targets the strain of flu that is in circulation that year. And so we don't call those flu boosters, we just call it a new flu vaccine because they're different. It's a completely different vaccine in terms of what the goals and outcomes of that vaccine will be for targeting specific strains. And so we're doing that with COVID-19. So this is an updated vaccine. So when you go to the doctor, you can ask for an updated vaccine and not a booster. So generally, we'll go over the updated recommendations for the vaccine. And with this, it's important that you talk to your healthcare professional because there are, more complex cases, and individuals' health history may play a role, and more specifically, what vaccine you or your child received could play a role. So, with that, individuals 5 years of age and older, regardless of previous vaccination status, are eligible to receive a single dose of an updated mRNA COVID-19 vaccine at least 2 months after the last dose of any COVID-19 vaccine. So like I said, this kind of mimics flu. So you go in, you get your single dose, and you're protected for the current strain. Individuals 6 months through 4 years who have previously been vaccinated against COVID-19 are eligible to receive one or two doses of an updated mRNA vaccine. And timing and number of doses will depend on the previous COVID-19 vaccine that was received. So again, this is where health history comes into play, and you should talk to your vaccine administrator. Unvaccinated individuals 6 months through 4 years of age are eligible to receive 3 doses of the updated authorized Pfizer COVID-19 vaccine, or 2 doses of the updated Moderna COVID-19 vaccine. So again, unique cases, age, health history all plays a role into your dosage, and these are very broadly the recommendations, but to get to the nitty-gritty of what's recommended for you, talk to your vaccine administrator or healthcare professional. Okay, so next we're going to talk about what's out there for those who are uninsured. And so parents and children who are seeking the vaccine, what's been true for quite some time is the Vaccines for Children's program, VFC, and VFC participating providers will provide children with no-cost COVID-19 vaccines. But to facilitate access for uninsured adults, CDC has established the Bridge Access Program. So this program will provide no-cost COVID-19 vaccines to adults without health insurance and adults whose health insurance don't cover the entirety of COVID-19 vaccine cost. And this program will be providing these no-cost vaccines until December 31st, 2024. And so, of course, the next question is, how do you find who's the participating healthcare providers or health centers or pharmacies? And vaccines.gov is the answer to that. So previously and most commonly, vaccines.gov was used to find all COVID-19 vaccines available in your area, along with flu, which you can see kind of in small letters right here. But this big blue button is what you would click on to find the Bridge Access participating COVID-19 vaccines. So you click on that big blue button, and then next you would want to enter your zip code and then select your vaccines, and then it's also separated by age group. So if you aren't sure and you just need to see what's available in your area, I would just go ahead and click all of them, and then you can see which is available closest to you and go from there. But if you need a specific one, you can go ahead and be more specific with that. And then next, you click over here, or in the next page, I have it side by side just so we can see it all. But in the next page, you can click on participating in Bridge Access Program, and that'll show the no-cost COVID-19 vaccines for adults. Next, we'll talk about how we can stay protected this fall. And so we know that vaccines are our best bet for preventing infection. However, there's more tools that we have access to that can be helpful. And so this model that we've shown a few times now kind of shows that these are layers of prevention and that you can layer them so that you can prevent and best protect yourself from COVID-19, flu, RSV. I think these are all valuable for all three of those. So, we have on one end our personal responsibilities. So staying home when we're sick, isolating, wearing masks, hand washing, and coughing etiquette. And then on the far end, we have our shared responsibilities as a community. And so that includes maintaining healthy ventilation in spaces, quarantining when necessary, and also vaccines. So this is a large spectrum of what can be helpful in preventing COVID-19, flu, and RSV. So next we'll go to our frequently asked questions. And like I mentioned at the beginning, these are all going to be pertaining to the new COVID-19 vaccine, or the updated COVID-19 vaccine. So if I had COVID recently, when should I get the updated vaccine? So right now, the general recommendation is that you can wait three months since your symptoms began, or for asymptomatic cases since you first, or for asymptomatic cases, you can do it 3 months since you first tested positive. So there's also some evidence supporting that you could wait as long as 6 months. However, this may not be recommended if you are at high risk for severe complications from COVID or contracting COVID. And this is something that is best discussed with your doctor if you have previously been infected with COVID-19, so that you can make the decision that's best for you. Are there any side effects to the COVID-19 or to the updated vaccine that are different from the previous shots? And the answer is no. So all the same possible side effects. So what's important is that we know that most side effects are mild, and side effects that are most likely to occur very soon after injection of the shot. So after injection of the shot, you might see some mild side effects, and then 3 to 5 days max, it should go away. And so if you're experiencing side effects longer than that, you should contact your your healthcare provider. And also, if you're experiencing side effects, the onset of side effects long after you've received your injection, it's likely that it's not associated with your injection, and you should still speak with your healthcare provider to flesh out what's going on. Are we going to have to get boosters every 6 months? Why are we always asked to get another booster? So this question is, the answer to this question is it likely won't be 6 months unless you are at high risk for severe health outcomes from COVID, and you're either immunocompromised or have some other co-occurring condition. And the reason why we touched on earlier is because we want to make sure that we are utilizing a vaccine that is targeting the variant that is most circulating the most in our community at the time. So right now, the variants that are circulating might not be circulating in 6 months or in a year. So that's why, like with flu, we will likely see an updated vaccine every year. Oops. Okay, is vaccine-induced immunity better than immunity from infection? And the answer is vaccine-induced immunity is better because it's safer. When you get infected with COVID-19, that has its own set of risks and complications, and those symptoms can wreak havoc on your body, and you can miss out on work, important events, and unfortunately, we are seeing people be hospitalized and dying still from COVID-19. So getting the vaccine, whether or not you've been infected previously or have had a previous vaccine, the updated COVID vaccine is going to strengthen your immune system to high levels to provide protection and do it in a safe way. So if you've been recommended to get the new vaccine for RSV, can you get your COVID and RSV vaccines at the same time? And this is a good question because, we've had this question in the past regarding, can you get COVID vaccines and flu at the same time? And unfortunately, there hasn't been formal studies on the co-administering of the RSV vaccines and the COVID vaccine because the RSV vaccine is so new. But that being said, the recommendation is probably to speak with your healthcare provider to make sure that this is the best option for you. However, generally speaking, there should be no reason why you can't get the RSV vaccine at the same time as the COVID-19 vaccine. Again, if that makes you uncomfortable, you don't have to get them at the same time. And also, they might not be available at the same time. The COVID-19 vaccine was very recently approved, so it might not be available for another couple of weeks from the time of recording this on September 15th. So you might not see that till the end of September or towards the end of September, early October in your area. And in the meantime, you can get your other vaccines that are available and not waiting necessarily to get them all at once. And also with that, it's important to remember that RSV vaccines are not broadly recommended for everyone. They are approved only for people over the age of 60 and individuals and anyone who's unsure should speak to their doctor on what's best for them and what's recommended for them based on their personal health history. So, thank you so much for listening to this edition of Vax Facts and FAQs. If you have question or feedback, you can reach us at nkfm.org, or you can check out our website where we have additional contact information, but also additional resources. So thank you and have